afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone. Thanks for joining us today. Since the last media advisory, we have 2 new confirmed cases of COVID-19 in our province, both in the Western Health region and under investigation. One individual is between 50 and 59 years of age, and one is between 60 and 69 years of age. There has been 1 new recovery in Central Health, leaving 22 active cases in the province, and the total number of cases in our province right now is at 2,059. No one is hospitalized as a result of COVID-19. We have been closely monitoring emerging evidence regarding the new COVID-19 variant known as Omicron. It is still very early days. We do not know for certain how this variant will impact transmission, disease severity, or vaccine effectiveness. The spike protein on the virus has approximately 30 mutations, which makes it difficult to predict how it will behave. And we need to gather more real-world evidence to gauge effectively its impact. Until then, it's important to remember that this is still a COVID virus, and we have the tools and the know-how to protect ourselves through measures such as masking, distancing, and hand washing. In the meantime, countries around the world are taking precautionary measures to mitigate the spread of the variant. The Government of Canada has put restrictions in place for travellers coming from the Southern Africa region where the variant was first identified. The variant has been detected in 4 Canadian provinces to date, and at this time, there's no indication that we have cases of this variant in Newfoundland and Labrador. But based on our previous experience with other variants and the global travel situation, we do expect to see cases here in the province eventually. We have been working with the Public Health Agency of Canada to identify and contact travellers that have recently returned from the noted regions so that they can be tested. And our public health laboratory can conduct whole genome sequencing on positive COVID-19 tests so we can identify the variant, and are working to develop effective screening tests. They are also in regular communication with national, provincial, and territorial partners. For anyone planning on traveling during the holiday season, please stay informed on the latest developments by checking the provincial COVID-19 website, the Government of Canada's websites, and sources for your destination province or country. We know that anyone not fully vaccinated is at most risk of acquiring and transmitting COVID-19. Provincial travel restrictions are still in place for partially and unvaccinated travellers aged 12 and older. These individuals must isolate until they receive a negative test on day 7 or later. After that, they are subject to limitations until 14 days have passed, and these include avoiding vulnerable individuals, crowds, and sporting events. Similarly, there have been no changes to the requirements for children under 12 that are not fully vaccinated and traveling with parents or guardians that are fully vaccinated. And for the full 14 days after arriving in Newfoundland and Labrador, children must avoid vulnerable individuals and long-term care or personal care homes. And while they are not required to completely self-isolate, they will need to avoid daycare, sporting events, and large crowds such as gatherings. After they receive negative results from a test taken on day 7 or later, they are permitted to attend school but must adhere to the other limitations. Any fully vaccinated children under the age of 12, for example, some may be coming from the United States now, they have no limitations, and parents can complete a travel form on behalf of the child and upload their proof of vaccination. I was thrilled to launch the start of our pediatric vaccination campaign for COVID-19 last week, and in the first 5 days, more than 10% of children between the ages of 5 and 12 received their first dose. There are 2 options for parents. They can choose to have their child immunized in school, or they can have it through a public health community clinic. Information and consent forms are being distributed by schools for those availing of the in-school option. Anyone eligible for a COVID-19 booster dose can book appointments through our website. The website also has phone numbers for each regional health authority if anyone is not able to book online. You can also book a booster shot by contacting your local pharmacy, physician, or nurse practitioner for availability. If you have someone in your life that may need assistance in booking a booster shot, please reach out to ensure we reach all of those individuals who are eligible. While there are no specific outbreaks in the province, we continue to see sporadic cases of the Delta variant, some without a known source. Through wastewater testing, we have detected the presence of the virus in Deer Lake, which tells us there are cases in the area, and yesterday's advisory has led to the identification of positive cases. If you have even one symptom of COVID-19, even if mild, please get tested. This is especially important if you are unvaccinated. We know those who are unvaccinated are at higher risk for severe disease and ICU admission. We are also making a specific request for anyone that traveled through and stopped in the Deer Lake area between November 19th and November 22nd to get tested if they are symptomatic. While our active case count is low, COVID is still out there and we still need to be careful. We have eased restrictions where the evidence shows that viral spread is less likely, such as formal gatherings with masking and vaccine requirements in place. But we must focus on where the transmission is most likely to occur. And we know, based on our own epidemiology, that it is informal gatherings in the home. I'm therefore recommending that informal indoor gatherings be limited to 25 people for the time being. This does not have to be the same consistent group of people as last year, but keep the number in your home or shed or wherever at 25 or less and try to ensure that there is space for everyone to distance from one another. If everyone follows this recommendation, it will go a long way towards reducing the risk of COVID spread and helping to ease the pressure on public health resources for contact tracing and investigation. I would caution those who are immune compromised or over the age of 70 and have not received their 3rd dose or booster dose to be extra vigilant this holiday season. With waning immunity, we know that these are the people most at risk for severe illness due to COVID-19, and I encourage anyone who is eligible for a COVID vaccine booster to get one. I know it has been a long haul, and we want to put COVID behind us, but we're getting there, but we're not quite there yet. So remember that we are in a much better place than we were last year. Most of the province is fully vaccinated. We can gather with family and friends, enjoy our activities, and welcome our loved ones home for the holidays. We know not what the future holds, so we need everyone's cooperation to stay the course. Before I conclude, I want to wish a very happy Hanukkah to everyone celebrating the Festival of Lights this week. And let's keep each other safe and hold fast, Newfoundland and Labrador. Thank you. I'll now turn it over to Leslie.
Thank you, Dr. Fitzgerald. We have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
In the U.S., because of the Omicron variant, they are pushing everyone who is more than 6 weeks out from their second dose to get that booster shot. They don't know yet whether or not that's going to have a big impact, but they do know it does increase the immune response substantially. Why aren't we expanding our criteria for those booster shots to anyone who's more than 6 months out from their second dose?
Yeah, so, we've always taken our direction or guide from NACI, the National Advisory Committee on Immunizations, with regard to how we have administered vaccines. So initially with the interval between doses and now with booster doses for certain groups in the population. So we'll be waiting for NACI to make that recommendation. And when they do, we'll certainly be considering that as we have often done or almost always done in the past, follow that recommendation.
And I want to ask about lifting restrictions. As you noted, we're 91% fully vaccinated, 95% with first doses. We're starting with kids. Considering that we've seen with children, disease has been very mild, especially outbreaks like on the Burin Peninsula. Why are we holding off on raising or lifting more restrictions when we're not seeing severe outcomes in those age groups?
So I don't think we've had enough cases to really make a comment about severe outcomes at this point. We certainly have seen with the Delta variant and in other areas of not just the country, but in the world, down in the United States, for example, we certainly did see that children had severe outcomes from this disease. And at one point, their ICUs were at capacity. So I think, we can't just... We're trying to reduce the risk as much as we can. We know that those who are unvaccinated are at the highest risk of getting and spreading this. And it's also not just about the children, it's also about who children can spread it to. So we're trying to make sure as best we can that we're getting our population protected. If we look at restrictions, we are actually pretty good with regard to restrictions. And there are very few restrictions in place at this point. And certainly compared to other areas, there are a few restrictions in place. So I think we're doing pretty well. We're getting close. So.
Our next questions are from Ben Cleary with NTV. Please go ahead and make your way to the mic.
Hi, and thank you. So what exactly do we know about the Omicron variant right now in terms of its severity or how it spreads?
So at the moment, there's some suggestion perhaps that it's a little more transmissible, but we really, there's a lot of confounding factors with that. We really don't have much information about disease severity at this point. Some of the countries where we're seeing this variant have very low vaccination rates. And so, even Delta in unvaccinated people can lead to quite severe disease. So we're still waiting to see some of that information come in. I think it's just the sheer number of changes that we're seeing with this variant that have people concerned.
Thank you. And because COVID was found in wastewater samples in Deer Lake and cases are sprouting up, can you tell us what's happening in Deer Lake today?
They've been encouraged to come and to go and get testing done. And I don't have testing numbers for Deer Lake, unfortunately, but, we don't usually break it down that much by site like that. But we certainly are encouraging anyone who's out there to get tested, especially if they have symptoms. It appears that we have detected some cases as a result of that advisory. So we know that wastewater really is a signal for us that there may be cases circulating in the area. So it is really important, especially for people who are unvaccinated. We know it can affect vaccinated and unvaccinated people, but we know that people who are vaccinated or who are unvaccinated, may get severe disease. So we really want them to get tested. We also want them to be careful.
Thank you.
We will now go to the phone. Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. The vaccine maker Moderna has predicted, or at least is suspecting, that the vaccine might be much less effective against Omicron. And as well, the WHO, the World Health Organization, has talked about it may increase the risk of reinfection. And so that leads to the question of boosters. But do you see this being a thing going forward, just booster after booster, when new mutations or new forms of the virus emerge?
So I think it's too early to tell at this point, really what's happening. I don't think the manufacturers are privy to any more information than the rest of us are. So, there have been some suggestions that reinfection may be a possibility, but we don't, again, there's a lot of confounding factors around that. And so we have to really take a really careful look at that evidence, and we can't just take it at face value. We really got to look at the context of where the evidence is coming from and interpret it in that regard. So, the boosters. I mean, we give boosters with lots of vaccines, and there are lots of we give boosters with lots of vaccine, and there are lots of viruses that have, changing makeup. The flu virus, for example, from year to year, we give a flu shot every year. So, it's not uncommon that we have to do this sort of thing, but I think at this point it's really too early to tell.
Thanks. And you mentioned the informal gathering, indoor gatherings limited to 25 going forward. That's, just to be clear, is that a recommendation? Is it mandatory? What should people, can you just be a little, just flesh that out a bit?
Yeah, so we're strongly recommending that. It isn't in a special measures order at this time, but we are strongly recommending it.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Thank you and good afternoon. The booster shots that are being pushed now in the U.S., you say that you have almost always taken your advice from the National Advisory Committee. Are you getting a sense from your colleagues across the country that there is increasing pressure to make a decision sooner than later on this rather than reacting too late?
So I think, everybody is looking at this question at this point. Some countries have already gone out with a recommendation, but so people have been looking at this for a while now. And, I really can't comment if other people are feeling pressure about changing it, but, we'll certainly take our cues from the National Advisory Committee on Immunizations.
Okay, thank you. And is there a possibility that the province will change its border testing and isolation requirements because of Omicron, or is that again just something that you're waiting? It's just a wait and see.
So I think we've certainly that is something. Anytime we see a new variant, we certainly consider how do we try to protect from that. I mean, obviously, like I said, it's very early days, and we're still learning about some of this information. But we're always considering how we can either detect it earlier or protect against it. So nothing, I guess, is really off the table. And border testing would be one of the strategies that we would think about when we're considering how do we respond to this.
Thank you.
I will now go back to Reach Reporter to see if you have one final question. Peter Cowan with CBC. Do you have a final question?
I do. We've seen the travel bans that, for example, the federal government has brought in place generally just slow seeing these sorts of cases. It kind of buys us some time to get ready. What specifically are we doing to get ready, and do we need to do in order to be ready for when, as you said, we are likely to eventually see Omicron cases here?
Yeah, so certainly we're in pretty regular conversations with our federal and provincial territorial partners. We've been meeting pretty regularly since last week when Omicron first came onto the scene. We're discussing how we identify it, how we can screen for it. We've looked at identifying people who could possibly have traveled from those areas to have them tested. So there have been some very early things that we've been doing. And of course, we also look at, as I said, our responses like our testing and case and contact management to see if it has to change. But given that it is very early days and we're still learning, it's a bit premature to do that at this time.
Ben Cleary with NTV. Do you have a final question?
Yes, I do. Can you walk us through again how many children aged 5 to 11 have gotten that first dose, and where do you hope that number will be by the new year?
So I hope it'll be 100%, as I always do, but just let me check here now. So in that age group, we have 10.5%. This is as of November 30th. Yep, so as of yesterday. So 10.5% of children in that age group, so 5 to 11, have actually received one dose of the vaccine. So that's about 37, just over 3,700 children out of about 35,000.
Thank you.
Brian Callahan with VOCM. Do you have a final question?
Sure. Do we have an idea or how many Newfoundland permanent residents might be affected by the travel ban regarding southern African nations? So working there or back and forth regularly or whatever, much like, say, Fort Mac?
No, I certainly don't have any information regarding that number specifically. We had a very small number of travelers who had come from that area in the 2 weeks prior, in the last couple of weeks. But with regard to how many would be impacted with regard to work and things like that, no, I don't have that information.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yes, I do. When the Vax Pass was brought in earlier this fall, there was an indication that exemptions would be made and that QR codes would be issued by the end of November. Do we have any idea how many exemptions have been issued and have QR codes being issued?
So, Peter, are you asking if QR codes have been issued in general or for people with exemptions?
For people with vaccine exemptions.
As far as I know at this point, there have not been, but I will have to confirm that.
Okay. Thank you.
Yeah.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks, Leslie. I guess, as the message has been for a long time, is make sure you get your vaccine. Parents, get your children vaccinated. If you're eligible for a booster vaccine, please get your booster. And if you have any symptoms that are consistent with COVID, please book an appointment to get tested. Thanks.
Thank you, Dr. Fitzgerald. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada. This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID.